So how does the government actually figure out if a new environmental rule is worth the cost? Well, there's a whole process for that. It's called a cost-benefit analysis. But what happens when the math itself is just wrong? We're going to break down a really interesting proposal to change how we value clean air and the hidden math that could, seriously, impact millions of lives.
It seems kind of impossible, right? Putting a dollar figure on something so fundamental. But for decades, that's exactly what regulators have done. They calculate the health benefits of less pollution. Fewer trips to the hospital, fewer asthma attacks. But here's the thing. A new proposal wants to change that entire approach. So at the heart of this whole thing is a proposed shift by the EPA. The new idea is to stop putting a dollar value on the health benefits that we get from cutting down certain air pollutants. Now, that might sound like a small, nerdy accounting change, but believe me, the consequences could be massive.
Okay, so the first big argument against this policy change gets into a really basic concept from data science. Just because something is tough to measure with perfect precision, that doesn't mean its value is zero. And critics are saying this new policy makes a huge mathematical mistake.
Think about a policy's value like a big math problem. You've got the costs on one side and all the benefits on the other. But what happens if you decide one of those benefits, like, say, our health, is just too complicated to put into the calculator?
See, when you just pull that variable out of the equation because it has a range of uncertainty, you're not just leaving a blank space. You're actually, mathematically, replacing it with a very specific and, frankly, a very misleading number.
And there it is. Zero. A big fat zero. By choosing not to calculate the health benefits, the policy effectively says they are worth nothing. The cost of preventing a child's asthma attack? $0. The value of stopping chronic disease caused by pollution? Zero. And that is the statistical falsehood right at the center of this whole debate.
So here's the crucial point that the author makes. Knowing a cost is absolutely greater than zero, but then recording it as zero just because it's hard to pin down a single number, well, that's the exact opposite of evidence-based policymaking. It's actively choosing to ignore the data we have.
Okay, so if these health benefits are officially valued at zero, do the real costs of pollution just disappear? Not a chance. The argument is that those costs don't vanish into thin air, they just get moved somewhere else.
So where do they go? Well, when a company's cost for regulatory compliance gets taken off their books, that bill just gets handed over to us, to the public. We pay for it. We pay for it through emergency room visits, lost workdays for parents who have to take care of sick kids, and the long, expensive slog of managing chronic illnesses. The cost is still there, it's just on our ledger now.
But this isn't just about shifting costs around. It's about who is being forced to pay them. And that brings us to the third critical argument, which is all about health equity. Because the burden of pollution, well, it is not shared equally.
The source material points out a really critical fact here. Air pollution hits certain communities way harder than others. So when you go and assign a $0 value to the health impacts, what you're really doing is erasing the specific, documented harm that is faced by the most vulnerable people. You're making their reality invisible in the official analysis.
All right, so let's pull these three core arguments together. It's really a story about math, it's about money, and it's about morality.
So let's recap. First, we've got the statistical argument. Ignoring a complicated value is the same thing as valuing it at zero. Second, the economic one. The costs don't just go away, they get shifted onto the public's shoulders. And third, the social justice argument. This whole method of calculation basically makes the communities that are hit the hardest completely invisible in the official map.
You know, the entire issue is just framed so powerfully by this one line from the source material. By focusing only on the easy-to-calculate cost of a factory filter, while completely ignoring the complex but very real value of human health, the analysis isn't really an analysis anymore. It's an omission. It's leaving out the most important part.
And this really raises a question that goes way beyond this one policy. I mean, think about it. In public health, in education, maybe even in our own lives, what are the crucial, complicated things that we might be accidentally valuing at zero, just because they're hard to count?